Hi, my name's Scott and I'm a 2023 graduate from Glasgow Dental School. I'm here to give a quick talk about a staff-student partnership project looking at the teaching of LGBTQ plus issues in dental education. I've done this with a senior colleague in the dental school, Dr. Binnie, in my senior years at the dental school. So just before I go on to describe this all, I'll give you a little kind of overview of the dental school structure because it's a little bit different. It's a bit of a unique student experience because most of your time is spent at the dental school on Sucky Hall Street, so you're not based over at main campus. It's a 5-year programme which was temporarily extended into 6 years due to the pandemic. There's a kind of blend of 3 core teaching areas throughout the course: biological and medical sciences, or BAMS for short, patient management and health promotion, PMHP, and clinical dentistry. In third year, you're required to undertake an elective study and a self-chosen topic in relating it to dentistry, which is usually a kind of period for students to travel and experience different practice and approaches abroad. However, during the pandemic, electives were limited to literature reviews, which was when I had done mine. So choosing my elective topic, you're encouraged to choose an area of personal interest and apply it to dentistry. At the time, I was looking at doing effectiveness of water flossers versus conventional string floss. Looking back, I'm not sure that was an area of personal interest, if I'm being totally honest. I ended up deciding after seeing an article in the British Dental Journal about caring for LGBT community to follow an elective in this area. It's a requirement during your elective to have a supervisor, and Dr. Binnie oversees kind of patient management and health promotion teaching. So I thought this was the best kind of area that this kind of topic falls under. So I pitched an elective focusing on LGBTQ plus health in relation to dentistry to Dr. Binnie, and she encouraged me to pursue the topic in an elective. So there was some initial debate as to what was the best way to proceed with an elective, whether it was to create a patient resource or resource for dentists to carry out our own research, or curate the kind of existing evidence and discuss what was already out there. We opted to kind of curate the existing research and discuss its findings. And the elective that we produced aimed to understand what teaching methods dental schools were currently using to teach about LGBTQ issues, and to understand the attitudes towards care for LGBTQ patients. And we done this through PubMed and a variety of kind of dental associations and health charities. So the elective produced this poster here. Our main kind of findings were that there was a lack of research anywhere else other than North America, and that graduating dentists in North America, between 8 and 13% of graduating dentists felt uncomfortable or not confident treating LGBTQ patients. We also found that the British Columbia University has successfully implemented teaching on this topic using kind of a range of teaching methods over a few days in a kind of concentrated style of teaching. So after I'd done my elective, this takes us on to the grant for co-creating the curriculum. Dr. Binnie had recommended that we apply for a grant to continue the research and address the gap that we had identified in the teaching from the elective, which led us on to this staff-student partnership scheme to co-create the curriculum. We received approval for the grant, and work started in October of 2022. And the aims of our grant were to review the current curriculum at the Glasgow Dental School and create a mapping for what is currently being taught and what needs to be strengthened regarding LGBTQ+. And an overview of underpinning existing literature and its relation to dental education and LGBTQ+ care. So we quickly realised that we would need a system to survey the existing teaching material for inclusivity. And after a bit of looking around, we found the W.O.R.D tool, which was developed by the Open University to assess teaching material for inclusivity. So it was kind of exactly what we were looking for. So what is the W.O.R.D tool? It's a tool that consists of 15 questions across 5 domains, and information is collected on good practice and areas that need to be kind of addressed or improved upon. So this is the 5 domains here. So writing with the audience in mind, opportunities for exchange and experience, representation through different lens, drawing on different experiences, and diversity as a subject matter. This is just a little QR code for the W.O.R.D tool if anyone's interested. It will pop up again at the end. So the W.O.R.D tool was modified by myself and Dr. Binnie to be suitable for rapid systematic review, which you can see over on the side. That was kind of the template that we were using. And using that, we reviewed kind of over 400 lectures taught from years 1 to 4 at the dental school in Glasgow. And these were reviewed according to the year and the subject area. So that led us to produce 12 W.O.R.D tools summarising all lecture material taught at Glasgow Dental School. So some areas of good practice that we identified in the W.O.R.D tool were kind of discussion around Scotland's policy for vaccinating boys and girls for HPV, gender neutral terms being used in case examples, and discussion of kind of modern attitudes towards HIV. Issues that we'd kind of identified using the W.O.R.D tool were inconsistent use of gender specific and non-gender specific pronouns in case examples and discussions, and also varying attitudes towards HIV from authors of lectures. There's also quite a prominent example in one of the lectures. It shows a kind of picture of Pamela Anderson, and the description says, stunning looks, fabulous personality, hepatitis C carrier, which is a bit outdated. We all know that you can't tell somebody's hepatitis status just from looking at them. So the prospects of the W.O.R.D tool, it's suitable for rapid review of large volumes of teaching material. It can be used to assess a wide variety of kind of teaching formats, so lectures, seminars, workshops. And it's highly transferable for other areas of interest, such as decolonising the curriculum. So kind of back to our findings using the W.O.R.D tool, we found that there was variation across authors of pronouns in case discussions and examples and lectures. And there was kind of different portrayals and attitudes towards HIV and the modern attitudes towards the disease. So from our findings using the W.O.R.D tool, our output and how we were going to disseminate this, we had two kind of approaches in mind. An integrated approach for modifying all kind of existing material that was already out there, or a standalone approach to create new material to provide kind of a succinct overview in one kind of location. We decided to go ahead with the creation of new teaching material, which included a lecture providing an overview of LGBTQ plus barriers to healthcare, and understanding LGBTQ plus healthcare, and a workshop on active bystander and pronoun training. Just some kind of reflections on working with Dr. Binnie on co-creating the curriculum. Working with a senior member of staff allowed me to pursue a large topic that would have been quite daunting for me to pursue on my own. Regular meetings that we had maybe every 2 or 3 weeks helped to keep the project on track and discuss our next steps. And working with a member of staff gave me kind of a point of contact through the research, and it encouraged me to pursue an area of interest within academia, in this case in relation to dentistry as well. The one thing that I would say is the grant would ideally be for kind of a longer period of time. Just looking back, it was quite difficult for us to produce the work that we did within a single year, and on top of doing my studies as well. So that's kind of my one critique, but that's me. Thank you for your attention. I'm happy to take any questions. And that's just a QR code for the W.O.R.D tool if anyone's interested as well. Thank you.